Hi, my name is Val Torres and I'll be talking about tonsillitis. So, first up, what are tonsils? So, tonsils are the two little masses of tissue in the back of your throat that they catch germs that try to enter your body through your mouth and nose by trapping them in their little pockets and crevices. Along with the adenoids, tonsils are part of the lymphatic system that clears away infection and keeps body fluids in balance. So, what are tonsillitis? Sorry, what is tonsillitis? Tonsillitis it is when germs get stuck in the pockets of the tonsils and cause an infection and swelling. It can make your throat really sore and sometimes cause difficulty swallowing. Tonsillopharyngitis is the medical term for this infection. Sometimes, along with tonsillitis, the adenoids are also swollen. So, what causes tonsillitis? Tonsillitis can be caused by viruses, usually 70% of the cases that cause colds, such as adenoviruses, influenza, Epstein-Barr virus, parainfluenza, enteroviruses, herpes simplex, or HIV. Or it can also be caused by bacteria such as group A streptococcus that can cause strep throat, Staphylococcus aureus as well. And in some cases, this type of infection can cause quinsy. So quinsy is a complication of tonsillitis that occurs when an abscess forms between the tonsil and the wall of the throat. Tonsillitis also has two types: acute tonsillitis, that this happens frequently, and this one being a majority of people get affected by, or also can be chronic tonsillitis, that this is considered when a person suffers this type of infections in a persistent or recurrent way, which means that they can get even recurring cases, like seven recurring cases in a year, five times in 2 years, or three times in 3 years. And then within the symptoms of tonsillitis, so the main symptom will be swelling, but the person can also experience throat pain or tenderness, trouble swallowing, fever. However, people should seek urgent care when temperature presents at 102.6 Fahrenheit or 39.2 Celsius. Red color tonsils, which means your tissues are irritated and they do not have that normal pink color, and a white or yellow coating, painful blisters or ulcers. You can also get headaches, loss of appetite, ear pain, bad breath, scratchy voice, and in children, symptoms may also include upset stomach, vomiting, drooling, or not wanting to eat or swallow. Okay, so how to diagnose? You may not need to see a doctor for tonsillitis, but if your symptoms persist or get worsened, you might want to visit your doctor. Or if you have had like recurrent cases of tonsillitis or strep throat. Just to clarify, strep throat is an infection that localizes more on the throat. However, most of the time, if you get a strep throat, there is a high possibility that you can also get tonsillitis. However, it is also possible to have either without the other one. So within the treatment, or like the things that your doctor can use to diagnose that, will be a throat swab to test saliva and cells from your throat for strep bacteria, and if this test results negative, that means that a virus caused it. He can also perform a blood test from you to get a complete blood cell count. This is to determine the severity of the infection in your body and the most appropriate treatment. These will be mostly for bacteria and determine the type and dosage of antibiotics required. He may also look for a rash. He will check for scarlatina, that is a rash linked with strep throat infections, and it will typically look red in color and have like a sandpaper feeling to touch. So for the treatment, like I previously mentioned, if the infection was caused by bacteria, antibiotics are needed to eliminate them. The person will feel better in about 2 to 3 days, and it is important to finish all the treatment to prevent from leftover bacteria to survive and reinfect you. However, if a virus causes it, there is no medicine to treat, just like kind of wait until it passes through a few days or weeks. You can apply at home measures like get plenty of rest, drink fluids, eat smooth foods, use a humidifier, warm salt water gargles, suck on lozenges or benzocaine for pain, and take medication for pain like acetaminophen or Tylenol or ibuprofen. So is tonsillitis contagious? So you can catch bacterial tonsillitis through contact with an infected person's saliva, including respiratory droplets, um, or by viruses. So, like I said, like although it's not contagious, the viruses that can cause them are. However, you can prevent them by hand washing often, not sharing food, drinks, utensils, or personal items like toothbrushes with anyone. Keep your distance from somebody with a sore throat or tonsillitis, and disinfect surface areas as much as possible if you or somebody is infected. Within the risk factors of getting tonsillitis, we have age. So children are more prone between the age of 5 to 15. This can be a risk factor for tonsillitis because children are more susceptible to infections due to their developing immune systems, and as well like elderly people, since as we age, our systems change and our immune system gets weaker. Um, exposure to germs can be a risk factor for tonsillitis because it increases the likelihood of infection. So children who spend more time with other kids, like in schools or daycare, are more prone to it, and as well adults who spend more time with children, like parents and teachers, are as well. Changes in weather, especially cold weather, can trigger this infection since cold temperature can weaken the immune system, and also smog can be potentially irritate your throat and the respiratory system, making them easier for infections to develop. And as well, your immune cells, like every people, certain people are more prone to having more recurrent tonsillitis, and this is just due to their immune system effective response. So, what could be possible complications of tonsillitis? So, usually happens only with viruses infection, but bacterial are not exception either. So one of the complications can be peritonsillar abscess, that is another term from Quincy that we talked about earlier, and then we also can have middle ear infection. We can have tonsil stones, obstructive sleep apnea, tonsillar cellulitis, or tonsillectomy, that is surgery due to chronic tonsillitis. So, tonsillectomy is a type of surgery to remove your tonsils, and this can be determined from several reasons. If the person keeps getting tonsillitis, or if has bacterial tonsillitis that does not get better with antibiotics, or they have tonsils that are too big and are causing them trouble breathing or swallowing. So the person usually gets this kind of surgery and goes home later that same day, and it can actually take about a week or two before the person completely recovers from the surgery. And these were the resources I used. Thank you.